communication skill. Thank you.
Good afternoon, Dr. Shamanta Rai, Shikhadi, Shondadi and my colleagues. Today I will discuss with you all in communicative skill in daily nursing. As nurses, more than any other profession, we have to communicate with all kinds of people as well as constantly to update our knowledge. For this purpose, we need to develop certain skill in English. Communicative skill help us to develop and polish our skill in reading, writing and speaking. In reading skill, there must be lighted to the In reading skill, there must be reading comprehension, vocabulary, grammar, and it helps to imbibe a lot of new words, and that helps while interacting in our profession and to read medical books relevant to us. Vocabulary helps us in many ways. A suffix is syllable to added to the end of the word. Similarly, prefix is added before a word to make another word. Example, antibody, which is made up the prefix anti and the body. The prefix anti means against, so it antibody means a substance that fight against the disease causing microorganisms. Coming next to the writing skill, which is really very important in our profession. To write official letters where we have to complain, request and perhaps order for goods is required by most professionals. Format of report writing and model of different type of report is being learned in writing skill. For academic purpose, to upgrade our knowledge, communicative skill is very essential. Writing clinical study, which is integral to our profession. A report which is an account of event, the kind of report, the style in which writing is depends on the writer, the event, the audience for whom it is intended. Report should be always clear, simple and precise language. There must be introduction, the body, the conclusion. Day by day, our profession is improving and preparation for clinical study is very important to expand our role in nursing. Nursing care plan based on clinical need is very important, in which good writing skill also required. Now, discoveries is rapidly being made in the field of medicine and better technique of nursing care are continuously being involved. It is important to keep touch of this development, and to do it effectively, we have to have a certain study skill. It helps us to learn note-taking technique, and from that we can separate the essential information from non-essential one. In our professional field, we nurses have to well aware about the spoken communication also, as we not only have to communicate with doctors and patients, but with the anxious relative of the patient as well as community as large. We need to be effective communicators. Formal and informal communication, telephone conversation is very specific. In our professional life, we nurses need to give interviews from time to time, so communication skill should be improved. For research purpose, for case presentation too. Well communicative skill will build up a trusting relationship within each other. Curing, relieving and comforting can take place. Questioning, listening and facilitating are three key skills which communicate effectively with others. As there are different purpose form of communication in nursing, we require some specific attention. So for our improvement, we have to talk with each other and discuss our problem and study every day, every time and whenever is convenient. Nothing much to say today. In next session, Anjana Dasgupta will discuss details about communicative skills. Thank you.